So previously we have talked about intestinal membrane transport, right? And now we will continue to the next session about primary factors and secondary factors influence drug absorption. So for primary factors that can influence drug absorption, actually divided into three parts, which are permeability, solubility, and dissolution. Permeability reflects the physiological properties of membrane to the solids. So fraction of drug absorbed is determined by the drug permeability through intestinal wall. Okay, and then for solubility, solubility is one of the physicochemical properties of drug molecules to effect drug absorption. So the drug molecules have to be dissolved in solution in order for absorption to occur in the intestinal tract. So if a drug, even though it has high permeability, but when it can't be dissolved in solution, it wouldn't be absorbed because that means the drug has very low solubility. And then the third primary factors is dissolution. Dissolution is the dosage from a variable to determine the rate and extent of drug dissolved in solution. So permeability is related to um, the membrane, and then solubility related to the drug molecules, and dissolution is related to the dosage form. So first of all, we will talk about the first primary factors. It's membrane permeability. So when we talk about membrane permeability, we will talk about effective permeability. This is terminology, effective permeability. Actually, effective permeability consists of passive permeability and active permeability. So for passive permeability of molecules across a membrane actually can be expressed as this equation. So passive permeability is equal to J divided by C or equal to dK divided by H, where K is the partition coefficient. We have talked about this in the first video. And D is the diffusion coefficient, and H is the thickness of the cell membrane. So the diffusion coefficient, or D, actually depends on the molecular weight or size of a molecule, while K is a measure of the solubility of the substance in lipid. So when a drug have very high K value, that means the drug have very high solubility in lipid. Okay, therefore the passive permeability here, the passive permeability is related to membrane and drug properties. Membrane properties is the permeability, drug properties here is the solubility. But for a specific drug, the passive membrane permeability should be constant, and we call PM. PM is the passive permeability and independent to drug concentration. And then we'll talk about the permeability for active absorption. For active absorption permeability, we can present this by this equation. It's quite long equation. So active permeability is equal to J per C. This is the general equation, right? Like just like passive permeability, but here the J, because it's active absorption, we have maybe you can open the previous video. We talk about the active absorption in intestinal membrane transport. So J here for active absorption drug, J is equal to J max multiplied by C divided by Km plus C. So this J max C divided by Km plus C is the J. And because we want to calculate the active permeability here, so we need to divide it by C or multiply by 1 per C. So here we can get the active permeability is equal to J max divided by Km plus C, because we cancel this concentration here, okay? Where J is the drug flux, J max is the maximum drug flux, C is the drug concentration, and Km is the drug affinity to the carrier. Obviously, in here, active permeability is dependent on drug concentration here, okay? Therefore, the total effective permeability is dependent on drug concentration for drugs that absorbed through both passive diffusion and active transport. So here we can get the equation how to calculate the effective permeability, as we talked previously, because it talks about effective permeability. So effective permeability is equal to passive permeability plus active permeability, where passive permeability here is equal to PM here, and active permeability is equal to J max divided by Km plus C, just like here. Okay, so if we want to calculate how much effective permeability of a membrane, we can get the value by accumulating the PM plus the active permeability here. For effective permeability, there are two requirements that depends on the concentration of the drug. So at very low concentration, where C is much lower than Km, the drug permeability is independent to drug concentration. So the effective permeability is equal to PM plus J max divided by Km only. Why? Because C is much lower than Km, so we cancelled or we neglected the C here. It should be J max divided by Km plus C, right? But because we neglected the C because it's much lower than Km, so here the active permeability only this one. So at very low concentration of the drug, we can calculate effective permeability by only PM plus J max divided by Km. This is for a drug that very low that have a very low concentration. But at high concentration of the drug, where C is much higher than Km, drug permeability is dependent on drug concentration. So here for P active here, okay, P active, as we know, is a J max multiplied by C divided by Km plus C, and then multiply by 1 per C here, because this is the J, and divided by C. So here J max P active is only J max divided by C, okay, because we cancelled C here, and Km is neglected because it's very low here. So P active only J max divided by C. And because the C is much higher, that means the C is very high, the concentration is very high, so the active permeability here count as equal to 0. So because P active is equal to 0, where if we want to calculate the effective permeability, it should be PM plus P active, right? But because P active is equal to 0, so effective permeability is only equal to PM, so PM only. So here, as we can see in the graph here, this is a permeability versus drug concentration. As you can see, here is the low drug concentration, just like this explanation. So at low concentration of the drug, here the permeability is very high. Why? Because the permeability or effective permeability is the accumulation of PM plus J max divided by Km. Okay, but at very high concentration of the drug, here the permeability is very low here, where the effective permeability is only count by PM. Okay, and this is the line of when the PM is equal to 0. It's for a very hydrophilic drug. Very hydrophilic drug means have very low permeability because the PM is equal to 0. Okay, and then here, after we learn about effective permeability, what for actually we count effective permeability? Effective permeability here because we want to calculate the fraction of drug absorbed. So how much drug that can be absorbed into the intestinal lumen and then go through the blood circulation. So here, drug permeability through intestinal wall will determine the fraction of drug absorbed, or FA. If you open my first video, we talked about the bioavailability. A bioavailability, or F, is equal to FA multiplied by FG multiplied by FH, right? And here we can calculate FA by measure the effective permeability as I explained previously. So FA can be estimated by drug permeability through intestinal wall. So here, this is the equation of a fraction of drug absorbed, FA. FA is equal to 1 minus e to the power of minus 2 AN. What is AN? AN can be calculated by T res divided by T apps. What is T res? T res is the small intestine transit time. So it's equal to 3 hours here for T res. And T apps is the absorptive time. And how to calculate the T apps or the absorptive time? We can calculate T apps by this equation. So T apps is equal to R divided by PF. R is the radius of small intestine. It's about 2 centimeters. And then PF is effective permeability that we calculate from the previous equation that we have learned in the previous slides. Okay, so by calculated T-apps, we can get the AN, and from AN here, we can get the value of FA, or fraction of drug absorbed. And now, after we talk about the fraction of drug absorbed, actually we can also use permeability to calculate the absorption rate constant. Absorption rate constant, or Ka. So this is the relationship between permeability and absorption rate constant, or Ka. So Ka is equal to P multiplied by A divided by V. What is P? P is the permeability or effective permeability, and then A is the membrane surface area of intestinal absorption compartment, and V is the volume of absorption compartment. And here, actually, this is the model for intestinal absorption compartment. Okay, so it's the radius, and this is the length of the intestinal absorption compartment. So we can calculate the surface area and the volume of absorption compartment. As we know, the surface area is 2 pi RL, right? R is the radius of the intestinal absorption compartment. L is the length, and here is the equation for volume of absorption compartment, pi r square L. And from here, we can cancel the L and 1 of R and also pi here. So we can get the Ks is equal to 2P divided by R. P is the permeability, R is the radius of the intestinal absorption compartment. However, this equation tends to overestimate absorption by about 12.5 volts. So actually, Ka is equal to P divided by 2 pi R, maybe more realistic. So for to calculate the absorption rate constant, or Ka, we can use this equation only. Ka is equal to permeability divided by 2 pi R. R is the radius of the intestinal absorption compartment. And then after we talk about the permeability is one of the primary factors influence the drug absorption, and the second primary factors is solubility. Okay, so solubility is the most important physicochemical property of drug molecules, which can affect drug absorption. The drug molecules have to be dissolved in the solution for the absorption to occur in the intestinal tract. So if the drug can't be dissolved in the solution, so it wouldn't be absorbed because it has a very low solubility. And here, the solubility of solutes are the maximum quantity of solids that can dissolve in a certain quantity of solvents or quantity of solution at a specified temperature. So the temperature will influence the solubility of the drug in the compartment. In here, because we talk about intestinal tract processes, so of course the temperature of our intestinal will influence the solubility of the drug also. And now, when we talk about the solubility, we will learn about two terminology. Here is the extent of ionization and the partition coefficient, or K. Actually, we have talked about partition coefficient in the previous video, right? So when we talk about the extent of ionization, we will know what else factors that can influence the extent of ionization. So ionization and pH play an important role in drug water solubility. So ionized form is usually more water soluble than unionized form. And unionized form is easier for absorption in the GI tract by passive diffusion than ionized form. So even though ionized form is more water soluble or have a higher solubility than ionized form, but only an ionized form can absorbed easier in the GI tract by passive diffusion rather than ionized form. So here we also can learn that for weekly basic drugs, for example, paracetamol have include in weak basic drug category. So more an ionized form would be predominant in intestine at high pH. It's about 5 to 8, which favor absorption. So usually, if we have or if we consume a weak basic drugs, so more ionized form, as we know, an ionized form is easier to be absorbed. It will be predominant in intestine. Okay, intestine. As we know, intestine pH is about 5 to 8. But for weekly acid drug, this is for weekly basic. Paracetamol is acid drug, okay, weekly acid drugs. So for weekly acid drug, more ionized form would be predominant in intestine. Okay, so actually, if the drug like paracetamol, it has higher ionized form in the intestine rather than an ionized form. Although in theory the ionized weak acid is not favorable for absorption in intestine, the larger surface area of intestine will compensate this weakness to produce complete absorption for many weakly acidic drugs. So even though weakly acid drug have very low unionized form in intestine, but because as we know, in the intestine has a very large surface area because of there is villi and microvilli, so it can compensate this weakness to produce complete absorption for them. Okay, and then when we talk about the partition coefficient or oil water partition coefficient or K, so low K value indicates high solubility in water, while high K value indicates high solubility in lipid. However, the drug molecules with high lipid solubility usually possess high membrane permeability rather than talk about the solubility. Because as we know, high K means very high solubility in lipid. So high solubility in lipid means high membrane permeability, because as we know, our membrane are consist of mostly consist of lipid. And then now we talk about the third primary factors that can influence drug absorption, which is dissolution of solid dosage forms. So if drugs are administered in solid dosage forms like tablet, capsule, right? They must be dissolved in the GI tract before absorption can take place. So, yeah, so it needs time because they need to dissolve first in the GI tract or GI fluids to be absorbed. For drug with low solubility and high dose, okay, the dissolution will be slow. Why? Because it has low solubility. Low solubility means it's very slow to dissolve in GI tract. So the dissolution rate will be the rate limiting step for absorption, means dissolution rate will be the most essential step for absorption. And therefore, factors that affect dissolution will control the whole absorption process here. This is specifically for the drug that have a low solubility and high dose. For dissolution, actually, Navier-Stokes equation can be used to describe the dissolution rate as this equation. So the Navier-Stokes equation is here talk about the dissolution is equal to A. A is the solid surface area, the solid or the drug or the dosage form surface area, multiplied by D. D is diffusion coefficient, divided by H, the thickness, okay, the thickness of unstirred boundary layer, and multiply by Cs minus C. What is Cs? Cs is the drug aqueous solubility, and C is the drug concentration at time point. And C will equal to 0 at same condition. So here is the model for dissolution of solid drug. This is represented as the particle of solid drugs here. Here is Cs, the drug aqueous solubility. Here is H, okay, H here, and then this is the C. C is the concentration. Okay, so for drug with low solubility, of course, formulation strategies are needed to enhance dissolution and fraction of drug absorbed. Here is some formulation strategies that can be used to increase the dissolution of solid dosage forms, which are micronization. Micronization can increase the surface area of the solid of the drug. Okay, and then the second strategy is ionization. So ionization can increase the CS, or the drug aqueous solubility, okay, because it will increase the ionized form, so it can be dissolved more in the aqueous phase. And then the third strategy is solubilization. For example, by using surfactants, it also will increase the CS, or the drug solubility. And then we can use disintegrant to make the dissolution faster. So this is some strategies to increase the dissolution.